So continuing with gender, I'm presenting with Patricia Galilea, work we did in Santiago de Chile, including a survey about gender transport. This is not working.
Sorry, you have to click several times in my experience.
With the
Maybe with the keyboard?
Oh yeah. Oh yeah.
So just to contextualize a little bit, gender perspective was called just a woman's issue in the past, but due to societal changes, we have started giving it more importance. Changes such as migration, aging population, and inclusion of women in the workforce have forced to have a paradigm shift. And all these changes have forced women to make productive and reproductive mobility patterns. So with these changes, we have created new concepts like mobility of care, care task chains, and female immobility. And the object of this is to describe female mobility patterns resulting from care work, since this care work is predominantly done by women. Transport planning has been considered as technically neutral, but now we know that it focuses more on work commutes and trips made by men that are between 30 and 45 years and travel by car. And so it has been determined that it's not only not neutral, but also the differential impact between gender systematically disadvantages women, creating barriers in transportation. So this is important to consider when we do gender analysis in transportation, because it's not only differential between women and men, we are also considering different populations like elderly people, children, people with mobility issues. So the gender analysis not only benefits women, it benefits the whole population. And we want to analyze how the different crossovers between variables, age, gender, mobility issues, etc., is analyzing the public policies.
I think sometimes the keyboard doesn't work. Oh, that worked.
So going on to motivations and objectives of this research, we have that most studies have been focusing on developing countries or have generalized women as one category, so not analyzing the different crossovers between variables. And we have that in developing countries, there are many differences that could be affecting travel behavior, such as unequal income distributions, which makes the cities highly segregated according to income, and that social cultural factors vary according to income classes. So beliefs and cultural norms are different according to your income. So this makes one of our objectives is to analyze how different crossovers between the variables determine female mobility and to be able to characterize women's immobility. Second objective is to create a survey that has less biases or data recollection, because mobility surveys usually don't have a category for care-related trips. They ask for the motives of the trips, if they're for work, if they're for school, but there's no category for care-related trips. Also, mobility data is not considering short trips on foot and don't reflect chain trips as well, breaking the chain trips, polygonal trips, into multiple trips and motives. So we wanted to construct an instrument that reduces this bias recollection, is able to describe the social context of immobility, especially focusing on those that don't travel due to care activities, and finally do a statistical analysis determining the weight that care mobility has in overall mobility. So this is basically the important part. We, according to the research we did, there are many variables that affect women's mobility patterns, while only age is a factor for men. So men change the travel patterns according to the age, but women have these different crossovers and intersectionalities of different variables, like if they have household responsibilities and care work, their marital status, if there are economic disadvantages, their income, if they are different according to time and destination. So there are different variables that are affecting females' mobility patterns. We also changed the definition of what a trip is because we wanted to analyze the chain trips. Usual mobility surveys, they break down the polygonal trip into different trips with different motives and transport modes. We considered a trip all the way from home to home and everything a woman did in between with the different questions we did for every stage. So these are a few variables we added to our typical mobility survey. In red are the ones that were really interesting to see. First, if the trip was a necessity for the home or to help others or for their own interest. Because, for example, a shopping trip can be done for your household or for your own. If they were accompanied with small children, with strollers or without strollers, if they were accompanying someone with low mobility, with a wheelchair or without wheelchair, and also if they were traveling with bulky objects. Finally, we added two socioeconomic characteristics that were really interesting to see because it was affecting our results. One is nationality, to be able to determine if someone is an immigrant, and association to First Nation population. We saw in our results that these both populations, they travel differently than Chilean people or that are not associated to First Nation population. So a few of our results, in terms of time, we are only going to show the three main results. First, we can see here, if we were asking people according to their motives, without asking for care work, we had these results. But when we were asking them if they were doing it for the household or for themselves, we had these results. So for example, shopping in the first question was 24% of the motives. But when we asked them if it was for their own or their household, it was only 9% of the shopping trips were for their own. We determined that care work accounts for 31% of the motives, while work is almost 40%. So this is a really high motive. It's the second highest motive for the survey we did. And finally, something that many people have told us is that there's not much difference between care work accounting for women and men. While women do 33% of the trips for care work, men are doing 26%. So many people have told us that's not a big difference, so good for the Chilean men. In terms of care task motives, we have found differences in the households without and with children. In households without children, women make twice as many care-related trips as men, while in households with children, the difference between genders gets smaller, suggesting a more equal sharing of tasks. So men are also doing care task motive trips. We also determined that most care-related trips are made by car because it's easier, or walking, with significant difference between genders. Men rely more on the car and women do the trips walking. Women declare to travel with children, people that need help, or bulky objects much more than men do. So they are traveling, they need help traveling and accommodations in the bus or the subway. In terms of immobility, we found that 22% of adult women do not travel during the week, compared with 70% of men. So this means that women are staying at home for care-related reasons, much more than men do. And the number of women staying at home for housework is 9 times greater than for men. So immobility is much greater for women than for men for care-related reasons. In terms of ethnicity and immigration, immigration status, which is also an important result in our research, is that ethnicity is influencing women's transportation, where immigrants rely more on public transportation. And this is important to consider because immigration is getting higher in Chile and I guess other countries also. So the behavior of this population has to be considered and how we plan our transport system. We also find that non-Chilean women, so immigrants, make trips with more chains and more trips than Chilean women. We found that non-Chilean women and men feel more insecure than Chilean people, which could be related to racial issues and discrimination. And we also found that First Nation women make more daily trips. So we have different patterns according to ethnicity and immigration status. In terms of conclusions, we have that, as I said, mobility studies do not consider short trips and fragment care trips into various parts of the chain. We considered in our study all the trips, no matter how short, and we considered the whole chain. It's important for the next surveys and mobility surveys to include care tasks as a travel motive to better understand chain trips generated by men and women. We also determined that transport planning is not technically neutral, and this means that we have to change how we plan transport policies. Our findings highlight significant inequalities between men and women. We couldn't see the different patterns here because of time, but the patterns are really different. There's a greater gender sensitivity to the different variables I mentioned at the beginning, and the importance of immigration and First Nation status in mobility patterns. So what is next? First, going into the reason why women are staying more at home, there are other reasons than just care-related work. I would also suggest studying more about how immigration status and First Nation status affects travel patterns, and also senior mobility and other communities that are smaller.